Let's now look at the latest consequences here of this virus from China. Only 2 new community infections in Victoria today, both contacts in a South Bank complex, who thankfully were already in isolation. The rest of Australia perfectly fine. Just Victoria again, which is another reason to wonder why Victoria has the country's lowest rate of full vaccination, people getting both jabs, just 2.5%. Despite Victoria, of course, having had nearly 90% of our virus deaths. Now, unfortunately, that vaccination rate seems unlikely to improve dramatically. Victoria claims it's run short of the Pfizer vaccine, the one for younger Australians. So it's taking no more bookings this week for a first dose of the Pfizer vaccine, saying it needs to keep enough to keep have enough second doses to be delivered at the right time. Now, AstraZeneca vaccinations, they're fine. You can get them still. Joining me is Sky News reporter Julia Bradley, who's been doing such great work covering the virus outbreaks in Victoria. Julia, thank you for your time. Why is there this shortage?
Well, Andrew, that's the million-dollar question. We've heard from Victoria's Health Minister today that the state's struggling to keep up with the demand, given the current supply of Pfizer vaccines that the federal government is giving us every week. So just when it comes to the Pfizer vaccine, we've been told by the federal government that Victoria is getting a supply of about 70,000 Pfizer doses every week for this month of June. That's that baseline supply. On top of that, an extra 100,000 Pfizer doses have been promised to Victoria, and that's being rolled out in the first 3 weeks of this month. In the last week of this month, an extra 50,000 Pfizer doses also being rolled out. The Health Minister, though, says that this isn't enough. We've seen a huge pickup in demand over the course of our lockdown and now our proceeding restrictions as well that are lingering here in Victoria. On some days last week, more than 20,000 Victorians were rolling up their sleeve. And the big concern from Victoria's government at this stage is that if this demand continues to hang around, they're worried that there won't be a big enough supply. As you say, this announcement by Martin Foley today that the bookings for the first dose of the Pfizer vaccine are going to be put on hold until we get up to date with the second doses that are needed.
To manage the demand within the constraints of the supply that the Commonwealth's program enforces on the states, we are now in a position of having to just calibrate those new bookings. So no further new first dose Pfizer bookings will be available this week, and no walk-ups will be available for Pfizer this week.
But Julia, again, I am so puzzled because the federal government keeps claiming, look, it is holding enough second doses. The states don't need to worry about that. So what's going on? Who's at fault here?
Well, Andrew, it seems like there's a bit of a communication breakdown here between the federal government and the Victorian government. As you say, we've been told all along that the federal government is keeping enough of these second doses for people who've already had their first dose on hand. But I've been told by sources in the federal government today that they suspect Victoria's been using some of its allotment of both first and second Pfizer doses simply to vaccinate people for a first time around. Now, this is something that the Health Minister today strongly refuted when I asked him that question. He said this is simply untrue. And he also said that, in fact, Victoria has been doing a lot of the heavy lifting when it comes to vaccinating some of the priority groups that was supposed to be a Commonwealth responsibility. Here was his response to that question.
At the request of the Commonwealth to assist with private residential aged care and disability workforces, Victoria had a number of blitzes to allocate some, I think it was up to 15,000 people who were meant to be the responsibility of the Commonwealth to vaccine.
Look, Julia, I've got no idea who's telling the truth here, but on past performance, you have to have a big question mark after Victoria again. So many stuff-ups. Just finally, quickly, the vaccine rollout in Victoria, is it likely to catch up with the other states anytime soon?
Well, Andrew, we've seen figures from the Senate that have showed that Victoria has the worst vaccination rate for fully vaccinated people compared to other states and territories. But when you look at the figures around the first doses, we are powering through. So there is the view that Victoria's rollout is going to keep picking up and up as that demand increases if the supply is there. Now, we were told by the Health Minister today that Victoria's utilisation rate every week, it's currently sitting at 91% utilisation, and that's the second highest behind Tasmania, and also something that can hopefully speed up the process, Andrew, now is the fact that this online booking system has now been launched for the Pfizer vaccine. So people can now book online, and they can also book by calling a hotline as well. So hopefully that's something that will speed up the process in the weeks ahead.
Julia Bradley, thank you once again for your time. I really appreciate the reporting you've been doing on this issue.